Hello, everybody. All right, let's do this 15 minutes, right? Let's go. So I'm excited to talk about our blockchain project at Veramos a bit and what we think its impact can be on connected cities and digital health and those sorts of things. And then I've saved lots of time for just discussion and Q&A. So I've literally I have like 6 slides, which should be 6 minutes, right? Right, the one for 1 minute for one thing. So my name is Brian Manell, and I'm the CEO of Veramos, and excited to be here. Thanks for having me here. So before we start, just a quick poll. I just wanted to know of the folks here. Raise your hand if you've ever worn some sort of fitness device on your wrist, or have a smart watch that you wear. Maybe gone to the gym, right? Tried to drink more water. Yoga classes, meditation on your iPhone, logged your run or something on your phone. I mean, it's like all of us, right? We all do these types of things. There's an incredible amount of data out there about all these things, and unfortunately, it's not terribly unified. Apple HealthKit does a pretty good job at keeping this stuff in our phone, but not too much. Well, we think that data has a lot of value, really, and also it can be used in interesting ways. So we're trying to take all that data, and we would like to put it on the blockchain and allow people to take advantage of it. Let me go to my next slide, right? So we've got all these things that we do. We take supplements, we go out for runs, we've got devices, we try and eat healthier. You can have, if you're like on the Whole30 diet, you can have meals drop shipped to your door for 3 meals a day plus 2 snacks, like on your doorstep for the week, every week, right? Make it super easy for you to do these things. So that's e-commerce data exhaust that we can capture too, right? So all this stuff is happening out there. It's all part of the trend that we would call the consumerization of healthcare, right? So people have started to take control of their own wellness, right? To stay out of the healthcare system, ideally, right? Like we don't want to go to the doctor. So all the things actually we focus on at Veramos, we would consider wellness, and it's all the data that wants to keep you healthy and out of the system. So we don't do anything with hospitals and payers and prescriptions and those sorts of things. There's a bunch of great companies doing that. We're focused on the other side of that coin, which we would consider wellness. So our core beliefs, or this is kind of first principles for us, is number one, that data has value. So as people in our ecosystem deposit that data onto the blockchain, we give them tokens in exchange for that data. So that's kind of the exchange. Gives them now a stake in our protocol, in our system, and the success of what we're doing, and recognizes the value of the data that they're depositing. So that's sort of one of our first principles. Second is around ownership. So one of the things that blockchain does for us, does many things, right? One thing is we can use those public and private key pairs to store this data with someone's public keys, and just looking at the data, you really can't tell. There's no personally identifiable information there. We've decoupled that from the person, right? So we can aggregate this data at large and look at it and do really cool things with it, which we'll talk about in a few slides, without revealing any personally identifiable information for ourselves. So kind of like the currencies that allow for private transactions, we can do the same thing with our wellness data. So ownership is really important. We think that everybody should be able to own their own data. Specifically for wellness, I know some real privacy pioneers in healthcare that have the same beliefs. Healthcare is very different. You don't actually own your healthcare data. Like legally, you don't own it, right? So wellness is a whole different thing. Like it's not in that category legally of data. So you can own your own wellness data and have your own record, and we can help make it easy and portable. Last is privacy is primary for us, right? So how do we do all this and let you own it and make it private? And the cool thing is that blockchain does all those things and more, right? So blockchain gives us tokenization to exchange value, gives us these public and private key pairs, and there's really not time to talk about smart contracts here, but when we can use those things to help people who don't know each other or don't trust each other to exchange value on our blockchain, then there's a whole world of new possibilities, right? So one of the cool things about this is benchmarking. So you guys all raised your hands about things that you do to try to get healthier and be well and stay out of the hospital and under a doctor's care. Like every time I meet people and sit down and talk to them, I ask them these questions like, what do you do? They talk about wellness, what do you do? And I talked to somebody just yesterday. They said, I'm taking fish oil tablets now. I go, that's really cool. Why do you do that? My sister-in-law said they're good for you, right? I'm like, okay, like great, right? So in wellness, there's like a lot of mythology. There's not a lot of data. Actually, all the data sets around this whole area about people are all in the healthcare side. It's all that data around if you had a heart attack, you were in the hospital, how long you were on an intubator, and then how long before you got out. And that's because of Medicare and Medicaid and billing and pharma and all those sort of things. So all the data in the world is around what the healthcare industry calls critical care. And we're focused on what they call ambulatory care. I'm not sick, I'm out and walking around. So one of the things this data set can do is can kind of benchmark. So I could look at this really massive data set and for myself say, okay, well, if I'm like 52 years old, right, I'm a white male, like what do people that look, what's my BMI, height and weight, what do people that look like me do to report feeling better? And I can benchmark myself and my data anonymously, right? It's like, oh, well, people that look like you, when they do these things, well, they get a little bit more sleep than you do, or they have a little bit better hydration maybe than you have. They take these types of supplements or eat these types of foods and nutrition, and they report better wellness. Well, now I have kind of an actual prescription, right? Not from a doctor told me, but just looking at the data, right? Like, what should I do? And I can benchmark myself. Now, I may or may not choose to do those things, right? Like, we all get that gym membership and hope that we go. Doesn't mean that we do. But that's one area where perhaps tokenization can help as well too, and we can talk about that. So, my last slide is, in terms of, we can look at, we have a mobile app that consumers use. We also have partners that do e-commerce and sell food and supplements and whatever, right? This is really near real-time data about population health, about people in your community, right? So here in Austin, we have the Dell Medical Center at UT, and they're very focused on how do we keep the population healthy around our county, right? So imagine now we have, almost real-time wellness data about what people are doing and what they're eating and how much activity and how many steps they're taking, all that sort of stuff, right? Like, what can we do with that? Like, it gets super exciting to think of how we could do things like, number one, how can we get proactive, right? How can we proactively reach out to people that might be on a non-healthy track in terms of activity, right? And kind of get them on the path. Can we use some digital tokens to incent some behavior, perhaps, like, at the government level or an employer level? Once we have stuff, data, we can do things with it. What could digital currencies do to change wellness behavior? When I talk to people in actual healthcare about incenting things, everything I come up with, they all tell me is illegal. That's kind of why I don't like healthcare, right? But big problem in healthcare, people go to the hospital, they're diagnosed with something, they get them healthy, they get them out, they give them some pills to take for the next 10 days, right? And what happens? After 2 days, they feel better, they stop taking the medication, and 7 days later, they're back in the hospital, right? Because they can't keep track of them. They're no longer within the four walls of the healthcare system anymore. They can't make them take medication. And so that creates those revisits, right? So how could we use things like mobile apps and data about what they're doing each day, and maybe smart pill bottles to understand if they're taking their medication, be more proactive, or use digital currency and token incentives to be like, hey, take these things, we'll give you some extra tokens for being healthy and staying out of the hospital. Like, to get readmitted, that costs like a lot of money, like a lot, right? So how many Veramos tokens could you buy to, would it be worth it to keep them out? Potentially a lot. In terms of data collection, and when someone's within the healthcare system and in the doctor, like, that's really expensive data because it costs thousands of dollars a day, right, just to be in the hospital. So very expensive data. When you look at the healthcare community and look at how cheap it is to collect this data when people are ambulatory, out and about, off apps and devices and those sorts of things, the data collection is awesome and it's really cheap to collect as well too. And then I think one of the most exciting things, in computer science, people are really into AI, right? And how are these AI and machine learning models going to develop, right? And these models take data, right? So number one, it takes two things to have really cool AI. Number one, you have to have a model. Number two, you have to have data, right? So we can get data in spades. When I talk to the healthcare people, they talk about the future of medicine being what they call precision healthcare. So this is a therapy that's designed specifically for you, right? So maybe you and I both go to the doctor because we have heartburn, but because we're different people and eat different things and have different levels of activity, the therapy for that should be vastly different, right? So we can do that with some AI and cool stuff. So anyway, my last slide, and with that, we have time for questions?
2 minutes for questions.
Great, and I'll be here for a while. We can chat in the back as well too. So any good ones? I answered all of them with all my talk. That's great. Elizabeth. So we don't share data with partners. We get data from partners. So our partners are companies that like sell healthy food, sell testing services, sell supplements, have mobile apps and devices as well too. So we're trying to get that data from our partners and put it in people's personal wellness record. So sharing is the person's responsibility. So I can give you my public key if I want to, so you can see my data if I choose so. So it's person centric for us. No, we don't sell it.
What's your timeline like? When do you expect to be in market?
Our mobile app is in test flight on my phone today. If you want to see it, I'll show it to you in back. And so hopefully by like mid-April, we'll have that out in the public. And then we're announcing some partnerships. Happy to tell you guys, we're all here, we're all friends, right? About some of our partnerships. So we'll be announcing some partnerships in the next like 2 weeks, which they touch millions of consumers and have tens of millions of data points. So for us, that's exciting because we're going to build literally the largest repository of wellness data in the world that we all still own, right? We own and control it, not Google or Microsoft or Facebook or somebody else. Like that's ours, right? So cool. Do you have time for the last one right there?
One last question. You guys like sort of long-term iterations for individual monetization to save personal data?
Yeah, so since the tokens represent your data, we want to get the protocol to be more valuable, maybe to government or industry or other third parties, right, while preserving the privacy. But as they can maybe buy tokens, inject them in the protocol to anonymously reach out to people, and then as the protocol gets better and the tokens have more velocity and more utility, and there's more people using them, right? So the vision is like, I order healthy food and I get some tokens for doing it or depositing data, and I can go use it to take a yoga class or something fun, right? So, so we're trying to create that velocity of really an economy around wellness data. So cool.
Great.
Thank you guys all very much. Happy to talk to you guys in the back later.